Hi, I'm Dr. J with the Health Revolution Clinic, and today we're going to talk about diabetes type 2. So diabetes type 2 is one of the most mismanaged diseases in this country and honestly in the world today. I see people every day from all over the world, and every day this is one of the diseases I see the most of, is type 2 diabetes or pre-diabetes. So I'm Dr. J. I've got the Health Revolution Clinic. I own the clinic and I'm the director of the clinic. It's a virtual clinic, so we see people from all over the world every single day. And again, diabetes and pre-diabetes is one of the things we see a lot of. So I've been doing this for over 2 decades and it continues to get worse and worse. And because we never really address the underlying issue of type 2 diabetes, instead of what we do is we throw medication at it. And we don't talk about lifestyle factors. We don't do the proper testing, and we guess. And by we, meaning the medical establishment. Our philosophy in our clinic is test, don't guess. So by doing a complete history, by looking at previous blood work, and I'll explain why that's important in a second, by adding some more tests if we need to order some more tests, we can actually give you a map that goes from I have diabetes type 2 to what are we going to do to get rid of it to type 2 diabetes is gone. And if anybody tells you that type 2 diabetes is not reversible or not be able to be cured, they're lying to you. Type 2 diabetes is completely reversible and can be fixed and can be addressed and can help you live a healthy, long life. So when we talk about type 2 diabetes, you're talking about things that if you don't address it, I've had patients that have come to me that have already lost limbs, feet, legs up to their knee, hands, fingers, all from type 2 diabetes, causing neuropathy, loss of circulation, all because the factors that were causing the problems, looking at the cellular level, looking at all of the tests, putting the big pieces of puzzle together to fix the underlying cause was not addressed, and now this person is losing limbs from type 2 diabetes. And here's a stat that grows every single year. Where it's at right now is 33 million Americans alone, that's not worldwide, 33 million Americans suffer from type 2 diabetes. That's 1 in 10. And here's the worst part. Another 88 million Americans suffer from pre-diabetes. That's 1 in 3. So it is a growing epidemic. We look at COVID, and COVID was a serious disease. But if we look at the major killers in America, heart disease, we look at type 2 diabetes is another one, obesity is another one, and then cancer. But cancer's down on the list. Heart disease, type 2 diabetes, and obesity, those are the 3 big ones. And if we don't address those, we're never going to reverse the fortunes of our healthcare in this country, and our costs are only going to continue to rise. And when I say costs, not only financial costs, but physical costs. The fact that you can't do things that you want to do. The fact that you might lose some appendages, some limbs from your fingers or hands or wrist or feet completely. And the other thing that you lose with type 2 diabetes that is very common is you lose your sight. So imagine not being able to see, all because no one said, hey, let's look at the root cause of your type 2 diabetes and let's see if we can address it. So behind me, you'll see the inflammation tree, and I use this all the time because it's the best and easiest way to explain how things happen in the body. So you see the leaves up back there. Diabetes type 2 is one of those leaves, and it is right there. So diabetes type 2, we look at the root causes: sugars, artificial sweeteners, metals, trauma, chemicals, drugs, excess calories. Those drive inflammation in your body. Inflammation is a good thing until it becomes chronic. And when it becomes chronic, meaning that it's happening all the time, that's when it causes disease. And it has been proven over and over and over again that if you have chronic inflammation in your body, you cannot heal. It has been shown over and over again, okay? So we have to reduce the inflammation in the body. And when we do testing in our clinic, we test for inflammation. And one of the reasons we test for that is, one, to show you that yes, you do have inflammation, but most importantly, so we can show you down the road that your inflammation's reduced. So not only are you feeling better, but you've reduced your inflammation in your body. And when you reduce the inflammation in your body, you're going to be healthier for longer. And that is a huge difference. There's a difference between health span and lifespan. Lifespan is, okay, maybe your lifespan is going to be till 95 years old, but your health span is maybe 75. What does that mean? Health span is how long are you going to live and be healthy and be able to function. If my lifespan is 95 and my health span is 75, that means I have 20 years of where I'm basically going to take up space and not be able to do things. That is not living. And so our goal is to make your health span and your lifespan, bring those two together, and maybe it's 90 years old, but you're gonna live 90 years of healthy, happy life and be able to enjoy your life and do the things that you wanna do. And that's our goal. And if we get rid of inflammation, which will get rid of the type 2 diabetes, we can actually give you that health span and lifespan matching. So when we look at blood work, do we always run blood work on every single person? I will say this, that we usually do run at least one test on almost everybody. Sometimes it's more, sometimes it's less, but each person is individual in our clinic. We don't have a set pattern that we do. And so when we look at your blood work, which most people will bring me blood work that they've had recently, and I'll take a look at that. And then sometimes we need to order some more to supplement that blood work. When someone says, everybody says it's normal. It's not normal. I can promise you that. You don't have normal blood work if you've got type 2 diabetes. So when we go ahead and look at that, we look at the blood work and it's not normal by this. In other words, let's take testosterone as an example because that has a huge window. So the bottom end of normal in some testosterone is 100. The top end is 800. So we've got 700, this huge wide space that is considered normal. Well, it's considered normal based on an example of taking 1,000 people. 1,000 people, we throw out the lowest and the highest, and then we take the lowest of those 998. That is the bottom end of normal. And we take the highest of those 998, and that is the high end of normal. Well, that is crazy because that doesn't mean that those people that are in those ranges are actually healthy. So the optimum range, so the range I just explained was standard range. The optimum range is actually 300 to 500. So instead of 700 difference, it's 2. And the optimum range is taking 1,000 healthy people that have no symptoms or no issues with their testosterone or their hormone system, taking the bottom end and the top end, and that is your range. So as functional medicine doctors, we look at the optimal range, not the standard range. And the other thing we do is we'll say, okay, so your testosterone maybe is at 199, or it's at 299, just below the bottom end of normal. Okay, let's look at a couple other things. Maybe there's a couple other pieces in that blood work of your hormone panel or blood work in your white blood cells or red blood cells that are explaining why that's on the low end of normal. And then we put those pieces together and we solve the problem for you. Not the problem that everyone else has, but the problem for you. And when I talked about earlier about coming up with that map, you have an individual map to health. And we go through that from day one. We do follow-ups with you. Our number one plan is to get you healthy. And a side effect of getting you healthy is getting rid of your diabetes type 2. So we talk about this and we can talk about it in more detail. But what I want you to do now is find out if we can work together, find out if our map works for you and if I work for you as far as personality and things go. So click the button right below me, schedule a discovery call. Discovery call is not a high pressure sales call. I can't stand them. And I know you can't either. So the discovery call is just for you and I to ask each other some questions. It costs you nothing but your time. And you're gonna talk to me, not a staff member, not anybody else. You're gonna talk to me, Dr. J, who's been doing this for over 2 decades. And we're gonna see if we can come up with a map that works for you. If we can, then we move on. If not, then we got to meet each other and maybe down the road, we can work together. But our goal with the discovery call is not to sell you anything. Our goal with our discovery call is to see if we can help you. My goal in my clinic is to cause a health revolution, hence why the name, the Health Revolution Clinic. And by health revolution, I mean, let's decrease the medications, let's get rid of the medications if we can, and let's get as many people healthy naturally as we can. So again, click the button below me, schedule a call with me today. I will call you at the time that you have scheduled, and we'll talk and we'll see if we can come up with a map for you. So I look forward to talking to you. I appreciate you taking the time to watch this video, and I hope to talk to you and meet you soon. Have a great day today, be amazing today.